guys, my name is Jasmine Brown and I'm a freshman in high school. I wanted to talk a little bit about anxiety because I felt that throughout middle school and high school, kids are held to a very high standard to speak in front of lots of people, like a classroom filled with 20 plus children, and just in general, a lot of pressure is put onto them. Personally, I've always struggled with speaking in front of large groups of people, so I brought my mom here, who's a psychologist, to talk about anxiety and help anyone who is struggling.
Hi everyone, I'm Dr. Paula Brown and I am excited to be a part of your mental health fair. Mental health is near and dear to my heart as much as young people are. I have two teenagers myself. One is Jasmine, who is a freshman in high school, like she already said, and I have my oldest daughter who is a freshman in college this year. And so again, I'm elated to be with you today.
Okay, so I've prepared some questions that will hopefully be informational to those who are watching. So the first question is, are there any underlying medical problems that could be causing anxiety?
Excellent question. One of the things that I am tasked to do as one who diagnoses anxiety disorder is to make sure that there are no medical conditions that could also be attributed to those symptoms. The main one that I want to focus on today is addiction. Addiction or the use of mood-altering substance absolutely mimics the same symptoms of a social anxiety disorder, a generalized anxiety disorder, an OCD disorder, just to name a few. And so I want to make sure that when I'm seeing a young person or an adult, that those substances are not present. And so we are not mistaking the disorder for the substance use. I know a lot of teenagers actually use substance use so that they can calm down, so that they can be the life of the party, so that they can be chill, or all the words that young people use today. But believe it or not, those same substances mimic the symptoms related to the anxiety disorders, and so it can confuse a professional like myself sometimes. So whether it be a physical medical disorder, another disease, or addiction, we do want to rule those things out first. So I'm glad you started with that.
Okay, next question is, what are the best ways to calm someone with anxiety?
The absolute best way to calm someone with anxiety is just to monitor your breathing. I love it. It's the most natural form of an intervention, and we all can do it at any point and wherever you are. And so one of the first things that young people and or anybody does when they become excited or anxious or fearful is that their respirations elevate. They do what we call hyperventilation, and you're giving your system too much air, and it is shallow breathing, and it's not the good quality breaths that we would like, and it shoots off the body system that causes us to think that we're in danger or that we need to be hurried or excitable. And so when we want to calm ourselves and we want to manage anxiety, particularly if you have an anxiety disorder, that you always want to manage your respirations. And so if you're okay with it, I'd like to do an exercise with you right now to help. And you guys can join us at home as well. So I'm going to ask you to place your feet flat on the floor. I'm going to ask you to place your hands comfortably on your lap. I'm going to ask you to shake yourself off a little bit, loosen up your muscles in your shoulders and your body just so you can get ready to induce this state of calm. I'm going to ask you to focus on your heart, right? I'm going to ask you to visualize your respirations or that air going in and out of the cavities of your heart. I'm going to ask you to think and sustain a positive thought. Something calming, something soothing, something uplifting. And if you find your mind drifting, I'm going to ask you to pull it back. All right? I'm going to give you a count of 4 in a hold. I'm going to give you a count of 6 in a hold and ask you to both breathe through your nostrils and to exhale the same way. So if you're home and you're trying it with us, again, we're going to ask you to place your feet flat on the floor. We're going to ask you to place your hands flat in your lap. We're going to ask you to shake off a bit. Focus on your heart. Visualize that air going in and out of the cavities of your heart. And we're going to ask you to think and sustain a positive thoughts and then breathe with us. All right? So Jasmine, are you ready? All right. So we are going to inhale, 2, 3, 4, and hold. Exhale, 2, 3, 4, 5, 6, and hold. We're going to inhale, 2, 3, 4, and hold. We're going to exhale, 2, 3, 4, 5, 6, and hold. Inhale, 2, 3, 4, and hold. We're going to exhale, 2, 3, 4, 5, 6, and hold. One more time. Inhale, 2, 3, 4, and hold. Exhale, 2, 3, 4, 5, 6, and hold. How do you feel? Calm. That's exactly what we want. Your body has a natural intervention and a way to induce calm, particularly before you do those presentations at school or something big that you have ready, like a game or something like that. All right. The other thing that I want to practice with you today, if you don't mind, is you talked about our presentations at school. Before you go and you do a presentation at school, what are you thinking?
I feel like I want to throw up.
I feel like I want to throw up. And if you throw up, what do you think the worst thing that's going to happen is?
It'll be very embarrassing.
It'll be very embarrassing. And if you are embarrassed, what does that say about you?
I suck.
I suck. Nobody wants to suck, right? And so cognitive behavioral therapy is a professional intervention that we use, but it has a part of it that everybody can do normally. It is finding the thought that is inducing the emotion and try to make sure that it's an accurate thought. You know, you may have heard this before, you may have not, but fear is coined as false evidence appearing real. A lot of times when you're anxious and you're nervous and you're worried, the information that you're encoding is not accurate. Do you think that kids that become nervous and they throw up, that they really suck? You don't. But that thought of sucking is bothering you, is causing anxiety, and it's not helping you to do your best work, right? So the next time that you go and you're preparing for this exam or this game, what else can you say to yourself?
What I'm feeling is normal.
What I'm feeling is normal. What else can you say?
Everyone feels like this.
Everyone feels like this. And so if I asked you to replace I suck with what I'm feeling is normal, how do you think you might feel?
Feel better. Feel calm.
I might feel calm. I might feel better. If I asked you to replace I suck with everyone feels like this sometimes, what might you feel?
Feel calm.
Calm. Which is what we want. We want calm. We want better. We want improved. CBT tells us that if we restructure our cognitions, if we take an erroneous thought that might not be true, that false evidence, and we replace it with something more accurate or more balanced, it will reduce anxiety, which will in turn affect the actions that we do. So cognitive behavioral therapy, or CBT, is monitoring our thoughts, which follows our emotions and then our actions. And so if we can intervene in our thoughts, and instead of thinking I suck, that this is normal, then our emotions will be calm and less anxious, and then our actions will be better and more improved. We will play a sport better, we will present better, we will just feel better in general, and we may not need to intervene with alcohol or drugs or other things that may harm our bodies. And so if you combine that breathing exercise that we just did with that cognitive restructuring and just challenging your thought, how do you think overall you might do when you have to do something in school that is of high pressure?
100 times better.
I'm going to feel 100 times better. Absolutely.
Okay, so the last question is, would you recommend a form of therapy or treatment for anxiety?
So a lot of us struggle with anxiety. In fact, when you think about overall fears in the world, public speaking is probably second on the list as the most anxiety provoking type things. If you were to speak to your teachers and your principals and other people, they would tell you they get anxious too all the time. And there are other worries and fears in the world, like you already mentioned. Not only do teenagers have schoolwork, but they just have other pressures, peer pressures, and to choose the right things. And so it's normal to feel anxious. And so we like to direct young people to intervene in a more natural way. Utilize exercise, utilize talking to their friends, utilize different relaxing games and activities that put the body in a natural state of calm instead of substance abuse or bottling it up or letting that fear really grip you. And so if you're able to intervene with running or, like I said, talking to your friends and it works for you, then you're okay. You just make sure that before the game or before the test, you're intervening. You're going to do something to take your anxiety down from a 10 to maybe a 5 or a 4, because you don't have to reduce it completely, because anxiety is sometimes good for us, believe it or not. Anxiety helps us to prepare for the moment. Anxiety helps us to put in our best work and to understand the gravity of the moment. And so we don't want to totally annihilate or get rid of anxiety, but we do want to reduce it so that we can do our best work. And so for individuals who are not able to intervene, like no matter what you do, not only do you have anxiety in public with public speaking or at parties, but you may go into what we call panic attacks, where you're physically, feeling like you may be having a heart attack and your heart is beating real fast and your palms are sweating and you feel pressure on your chest. We do want you to go get yourself checked out with a professional such as myself. And so that doesn't mean I'm going to tack a diagnosis on you or harm you in any way, but I'm going to check out your level of anxiety and see if it's normal or it's what we call a clinical anxiety, where it may need some type of therapy like CBT, or it may need medication or something like that. And we're going to take good care of you if that's the case. And so we want you checking yourselves out when your intervention doesn't work. But we do want everybody intervening. We want everybody trying something in lieu of the things that may be harmful to your body.
I hope this information was helpful to anyone watching. Once again, I'm Jasmine.
I'm Dr. Paula Brown.
And we're signing out.
We are signing out.